All right, I am excited to talk to you guys today about what vestibular therapy is because I feel pretty strongly about it. I've seen it truly help people pull themselves out of some dark places and return some normalcy to their lives. And really, it's been such an honor to guide those people through that journey. But most people have never heard of it before, even among medical providers. Or if they have heard of it, they don't really know what it involves or how the heck it's supposed to help with their dizziness. And that's a real shame because it can be a very powerful tool when used correctly by an expert who knows what they're doing. So I'm going to go into maybe a little bit more depth than I need to about what vestibular therapy is and how it can help you if you're suffering from dizziness, vertigo, unsteadiness, or any other kind of movement-related symptom. If you've reached this video with a Google search, you've probably already found a bunch of definitions for vestibular therapy, some of which may have been a bit complicated or technical. In this video, I want to break that down and focus more on how vestibular therapy actually works for people and even how to approach vestibular therapy for the best results. So my definition of vestibular therapy is it's a type of physical therapy that uses specific exercises to retrain the brain and inner ear to sense movement correctly. So a type of physical therapy that uses specific exercises to retrain the brain and inner ear to sense movement correctly. Now, the Epley maneuver and treatments like it are a little different. Many people may have heard about this. These are maneuvers used to treat positional vertigo caused by crystals in your inner ears moving around where they aren't supposed to. Vestibular rehab can include this to fix this kind of vertigo pretty easily, actually. But it's not so much about retraining the brain. It's about fixing that particular mechanical problem in your inner ear. A very important component, I don't want to downplay that, but it's a little different than what I want to emphasize today because that treatment is so effective. I think a lot of people miss the other parts about vestibular rehab. Once a problem like BPPV or an inner ear infection or even a Meniere's attack subside, the brain still needs some help getting back to normal again. That's why people often don't feel 100% or sometimes even worse after an inner ear problem is over. You see, the vestibular system, which includes your inner ear and all the connections in the brain, is in charge of sensing movement. These parts of the brain that are involved in sensing movement take in information from the inner ear, but also the eyes and the rest of the body, and integrates all that information to make sense of where you are in space. So really, we're talking about the brain here and how it integrates all this sensory information, including from your inner ear. So really, it's no wonder that the symptoms associated with this can be so overwhelming. These parts of the brain have a lot of what's called neuroplasticity, which means it changes and learns. Neuroplasticity is a powerful thing. When a person has a vestibular problem, that whole process of sensing and perceiving movement is disrupted. So the brain is interpreting movement all wrong, and this is what results in dizziness, balance problems, motion sickness, among other things. But the good news is that neuroplasticity allows us to rewire the brain to sense movement correctly again by exposing it to the right kind of stimulus and promoting the right output from the brain. Some people refer to it as strengthening the inner ear, but really it's teaching the brain how to make sense of the movement information. So what does this mean? Well, the brain does two main things with the movement information. It moves the eyes to keep up with the head, and it communicates with our muscles to keep us balanced. So that's why when our movement sensing system malfunctions, we get dizzy with head movement or movement in our vision, and why we feel unsteady. If we can give the brain the right kind of information or feedback about our eyes and our balance, our brain can learn. And these things can actually get better, just like learning how to walk again or how to throw a baseball. So the exercises in vestibular rehab are going to target regaining your balance and visual focus, which will eliminate the dizziness altogether. And that's the power of neuroplasticity. Sometimes the exercises involve bringing on symptoms. Because part of neuroplasticity involves challenging that impaired system. But this is just like feeling like a muscle burn when you lift weights. You really want to make sure that you're challenging the right systems, the ones that are causing you the most problems, and challenging it the right amount to make a change, but not end up too quote-unquote sore. With that in mind, it's totally okay and normal to be dizzy after doing vestibular therapy, and it will get better, just like with lifting weights. You should notice that the same amount of movement stimulation makes you less and less dizzy over time until you can gradually tolerate your normal activity levels. Assuming you're stimulating your vestibular system just the right way, you should notice improvement within a week or two, maybe even a few days. So the most common reasons I hear people supposedly fail vestibular rehab is because the exercises were either too difficult or not targeting the right impairments. It's really easy to make the exercises too difficult because we all just want the dizziness to go away, right? And if some is good, more is better, right? Well, not in this case. Because of how the vestibular system is so tied into your autonomic nervous system, overstimulation or too much anxiety associated with the dizziness can cause a sympathetic response that trains the brain in the wrong direction to be avoidant and have more anxiety, rather than to sense the movement more optimally. When this happens, it's not really a big deal in that you haven't hurt anything, but it does mean that the exercises need to be adjusted accordingly. And too often, this is when people quit. I also hear people say, well, vestibular therapy helped with my balance, but not my dizziness when working on the computer. Or it helped with this symptom, but not that one. Movement sensing is very integrated with many of our other systems. So the symptoms of vestibular dysfunction can be extremely, sometimes wildly diverse. It affects your balance, your anxiety levels, your posture muscles, your ability to keep your eyes stable when you move, your ability to integrate movement in your vision with movement of your surroundings. Each of these things, these components, needs to be assessed for a problem and given a targeted, specific treatment. A therapist may want to start with the biggest problem first, But that doesn't mean there aren't other issues that can be helped or different contexts or environments to consider. A good vestibular therapist should have many tools in their tool bag, so to speak. So therapists and patients should be persistent and patient with their therapy goals. Any research study you come across will support vestibular therapy for treatment of movement-related vestibular symptoms. So why isn't it utilized more? One reason vestibular therapy is underutilized is that it's just not that well understood. Although things are definitely changing for the better, and I can see that more and more therapists and doctors are getting on board with vestibular disorders, it's still not a widely talked about thing and considered very specialized. Many of the treatments are relatively new in the field of medicine, which moves very slowly. This is getting better, but the biggest area of impact for getting vestibular disorders diagnosed and treated quickly before they can cause the huge loss in function and productivity is in emergency rooms and primary care offices, where people with dizziness usually go first. It's important to start treatment quickly because of how debilitating this dizziness can be for some people. So I believe that you shouldn't wait to start vestibular therapy. Once you suspect it's a vestibular disorder, delaying therapy to do a bunch of tests only increases anxiety and delays full return to function, which at the end of the day is what really matters to people. I'm not saying that differential diagnosis isn't important or that vestibular therapy is useful acutely, just that you shouldn't delay referral. That's my opinion. The bottom line is don't delay getting vestibular therapy if you think it would help. So that is my vestibular spiel. I'm not going to talk about any specific exercises today because it may not be the right one for the person who's watching this video looking for help. But understanding the goals and rationale behind the therapy will help patients and clinicians alike get the most out of their referrals. So I do hope this video has helped some of you. Don't hesitate to contact me with questions at dizzyphysio.com. Bye!